I would like to welcome you all to this free webinar, in which we are going to talk together, okay, about how to make use of this couple of weeks before the exam. And also, we are going to show you our plan for the next batch. I know there are some colleagues who would like to prepare for the joint exam. So also they would like to know more about our future plans. So also I'm going to talk to you about the plan of our course. And then we are going to answer a few questions. So first, let me talk about the way of revision or preparation these days before the exam, okay? I will also listen to your queries and questions, but I will start talking first. Then by the end of the session or the webinar, I will listen to your questions, especially if they are related more to the preparation or how to prepare yourself for the Part 1 MRCOG exam. So we know that MRCOG Part 1 exam is with the format of single best answer. So that's a good thing because we don't need to, read paragraphs. When you have a short essay questions or short account questions, you need to memorize everything to be able to write a short paragraph or a short note about a certain disease or something like that. But when we talk about single best answer questions, the good thing about that, when we study, we read, understand, and highlight the keywords, okay? Or the important talks about important words, I mean, about certain information which guide us about the answer, okay? So first, what should we do in these last few weeks before the exam? Or I can say we have about 3 weeks till the exam. What should we do? First of all, we need to have a calm environment for studying, okay? I know that many of us have heavy routines and heavy duties every day, but at least try to, if you can, of course, have some days off or have, to organize your schedule so that you can have at least like 4 or 5 hours per day you can read something. That will be a very good thing. Plus, you need to be calm, okay? A very important thing in these days not to be very stressed, because stress will be having a negative impact on your performance. I know that we all care about the exam, care about the marks and everything, but you have to be reassuring yourself that you are doing your best and the exam is it's not a difficult exam. Part 1 is not a difficult exam. It's not very easy, of course, but it's not difficult. You can pass the exam with the basics and the clinical information from studying. A very important or a common mistake that candidates do these days, that they start opening new sources. That's a very common mistake. New sources doesn't mean that you will get more marks. On the other hand, it may distract you. It may cause more stress on you. Why? You have been studying from certain sources or having a certain information in your mind. Now you listen from one of your friends or colleagues, or even in one of the social media groups that someone is studying from another book. You feel like you are not satisfied. You need to look for other books, and so this will cause much more confusion to you. So that's a very important point that you have to avoid. Avoid starting new textbooks or new sources. That's a critical point. You have to solidify your information from the sources that you have already gone through. Okay, this is one of the important points. Plus, ignoring having a schedule in this or in these weeks before the exam. Okay, you should have a fixed schedule, and you should know what you should cover each day. Okay, you have to wake up every day. You know that you have this task to cover. For example, today I need to revise half of the anatomy, for example, plus answering like 100 questions from certain past paper exam or recall exam. Okay, so you need to have a daily schedule. Don't work randomly. Okay, don't work like with a chaos. No, you have to arrange your time. You have to organize yourself every day. Okay, and also spare the last couple of days before the exam for the last minute revision. How? By going through the subjects through these weeks and through the questions, you will find that you have strength points, that these topics you already covered well and you memorized them well. Another points, for example, you will feel that you have some weakness in these points, or some questions you have done some mistakes with. So you will highlight these points, you will highlight these questions, and this will be your last minute revision. Plus your short notes, if you have summaries or notes that you have done through your the time or through your time of studying. Okay, you will revise these notes in the last couple of days before the exam. So this arrangement will help you so much. Okay, but ignoring the arrangement or the schedule will give you this feeling that you are doing nothing. Okay, but once you have a schedule, once you have a checklist every day, this is very important. Also, at this days, you should ask yourself, what do I keep getting wrong? Don't ask, what haven't I studied? No, what do I keep getting wrong? I mean that you have to look for the difficult points you are facing through the time of studying, or the questions you always do mistakes, or the weakness points. Like, for example, you feel that you are not very good at answering the APG questions. So I'm going to revise this. I'm going to practice that. Okay. I have some problems in some clinical points, like, for example, how to manage the heavy menstrual bleeding. So I'm going to revise this guideline very well and practice some questions about these guidelines. So this is what you should do. Okay. Also, give yourself a simulation for the exam. This is also critical. How? Don't make your questions that you practice daily like a fixed questions for a certain subject. No, make it random questions. I mean, you have to answer embryology, then anatomy, then physiology, like pick up 10 questions from each subject and answer them. Okay, or answer an exam. If you have the recalls or the past papers, you can answer one exam. Plus, making a time for your practice. I mean, I will give myself 2 hours and I will answer this exam or these 100 questions. Of course, we know that the time of the exam is 2.5 hours for each paper. You can practice to answer the questions in 2 hours only. So in the exam, you have the ability to finish and revise many times before the time is finished. Okay, so also when you practice, make like a stopwatch, okay, for answering the questions, to give yourself an environment like the exam or a simulation for the exam, and also make the questions random. Because when I answer questions for one subject only, that's easy. My mind is, focused on this subject. But when I face random questions, this is what you are going to face in the exam. In the exam, the questions are going to be random. Okay, you can face one anatomy question, then one embryology, then one physiology, then again one anatomy questions, and so on. So it's very important to make this simulation. Also, it's very important from now until the exam to try as much as possible. I know we are still have work to do or routine to do, okay, but still, if you are able to make a fixed routine for your day, like your sleep at certain time and you wake up at a certain time, this will be very beneficial. Okay, this will clear your mind, make your mind very clear when you study, and also you are not going to be exhausted before the exam. And during the exam day, you will feel that you have the power to withstand the 5 hours of the exam. Okay, so this is a very important point. Another thing you have to consider that focus on the high yield topics. Okay, the high yield topics are the important topics at each subject. For example, in the anatomy, don't waste too much time. Like if you have a certain book writing anatomy of the stomach, for example, you're not going to be asked about the stomach, okay, or the blood supply of the stomach, for example, or anatomy of the lower limb or the upper limb. Okay, of course, you have to be perfect in the anatomy of the pelvis and the perineum and the female genital system. Then some other points which is related to our practice, for example, the anatomy of the pituitary gland. Okay, otherwise don't waste your time. Okay, especially if you haven't gone through these topics before, like I mean these extreme topics. So don't waste your time at these critical days before the exam. Yes, maybe some of you already covered everything before, it's okay, but when you revise, okay, focus on the high yield topics. Same for other subjects. Like, for example, you have to be perfect in the reproductive endocrinology. It's not acceptable that you are having an obstetrics and gyne exam and you are not understanding the menstrual cycle, the ovarian cycle, things related to reproduction or the contraception, for example. Same for screening test for the baby or the fetus in the genetics or the inheritance pattern. You should know drugs and their effect in pregnancy, like the teratogenic effect, side effects, things like that, microbiology and the infections, maternal sepsis, things related to pregnancy as well, physiological changes during pregnancy. Like I don't get that why I should, study like nerve transmission or how the muscle contract. This is not related to our practice, but you should study the physiological changes during pregnancy. So these things are very critical and very important. Other things, when you answer the questions, you have to understand the stem of the question or the heading of the question. What does the examiner need from me? Okay, read the question very well. Through the courses we give, I usually find that most of the mistakes done by our dear candidates, that they rush in reading the question, especially if they have seen this question before in a previous exam. But the examiners can do some tricks. They can give you the same idea, but they change something in the question. So when you see the question for the first instance, you memorize the recall and you rush in picking up the answer, which is of course wrong, because there is a change in the heading of the question, so the answer will be changed. Okay, and this is usually done by the examiner. Okay, they can bring the same idea, yes, but they change something in the scenario, so the answer is different. Also, you have to look at the key words in the heading of the question, like what is the examiner asking? What is the best next step, for example? It's totally different from what is the first line management. There is a total difference between this point and this point. Next step means that I'm now seeing the case, okay, and I have certain information from this case. So there is something I need to do. For example, a case coming for you with antepartum hemorrhage, okay. So what is the next step before anything? You should, for example, if he didn't mention that in the scenario, that you have to like insert a cannula and resuscitate the patient if the patient is needing resuscitation. That's the next step. If he mentioned this scenario, like the patient already came and you have inserted the cannula and you have taken blood sample for group and save, what is the next step? Then the next step, I have to exclude placenta previa by making an ultrasound. Okay, this is the next step in this scenario. No, he gave you that the step is that the scenario is the patient was diagnosed with placenta previa and she is 38 weeks and she is bleeding. What is the next step? The next step should be delivering the patient by cesarean section. So each time, or the scenario may look similar, but the more information is added in the heading of the question, now we have changes in the answer. Also, you can look for the first line management. For example, a case coming for you with heavy menstrual bleeding. Okay, so what is your next step? Okay, next step for a patient coming for heavy menstrual bleeding, for example, I will do some lab investigations like CBC, thyroid profile. Okay, then I will do an ultrasound scan to see if there is any pathology in the uterus. Okay, this is totally different from being asked that the patient is having heavy menstrual bleeding and she has no pathology at all. You have done the investigations, there is no pathology. So what is, like, it's a dysfunctional bleeding, I mean. So what is the first line management according to the NICE guidelines? The answer will be inserting an intrauterine levonorgestrel system or the Mirena or the hormonal loop. Okay, so this is how you think about the question. This is very, very critical and very important. When you read a question, you have to be very calm. You have to understand what does the examiner needs from you. Again, I would like to stress on that in these days, your brain needs calm more than content. Okay, but like I told you, don't try to overwhelm your brain by new sources. It's the time to solidify the information you got. Yes, you can be subjected to new information while you are answering questions. That's very common and that's accepted. Like, for example, I'm answering this question. It's a new information for me. That doesn't mean that I'm going to read an entire topic for this question. No, I will take the information mentioned in this question. I will record it in my notes and I will revise it in the last minute revision. So these are very important tricks and tips you have to consider while revising in these weeks before the exam. Again, making a schedule, daily schedule, okay, having part to finish, like a theory part. I will revise these topics from anatomy. Then I will keep the remaining part time of the day answering these questions. And while you answer these questions, put a timer for yourself to know the rate of answering the questions. For example, I can finish 10 questions, for example, in 10 minutes or in 5 minutes, or I need more time. So you have to, adjust the timing that you can finish the 100 questions in a reasonable time. But let me reassure you that time in part one exam is more than enough. Don't think that the exam will be so strict. In part two, yes, I can say that the time is strict and you need to be, somehow fast in reading the questions and answering it. But in part one, the exam, usually the time is more than enough. So don't rush in reading the questions. Read the question carefully. Look at all the options, please, please, please. That's very important point. Read all the options. Deal with the question as you are seeing it for the first time. Even if you have answered this question 100 times before, and it's the same question, repeated by the same words. Read it carefully, read the options carefully, make sure that there is nothing changed from the previous recall and then select your answer. So trust yourselves, trust your preparation, okay, and start making your revision schedule. As I told you, couple of hours for reading theory and spend most of the time answering questions and practicing and making simulation for the exam. Okay, so in the exam, I will look for some questions in the chat box in case I need to answer them immediately. Okay, so for any materials, you can contact the backend team and you know how you get the materials you need. For the lab values, most of the questions come with clear lab values in the question, like they will give you the reference range. But if I'm recommending you to memorize certain lab values, I will recommend you to memorize the semen analysis and the APG values. Okay, these are important. In some cases, they may be not mentioned, especially in the semen analysis. Of course, they will give you the values and ask you to interpret whether this is oligospermia or athenospermia or something like that. So if you are going to memorize certain lab values, memorize the ABG values, like what is the pressure, normal pressure of oxygen, CO2, what is the normal pH, what is the normal bicarb level, okay, and the semen analysis values. I'm going to talk about the next batch, okay, but anything related to registration, of course, this will be with the backend team, and they will give you the links how to contact them. Yes, in the exam, you can skip the question and then you can go back to the question later on. And this is one of the advice I always say, that when you answer in the exam, you have to go through like rounds, okay? Like round one, I'm going to go through the 100 question, like question one easy, and I answered that. Question two easy, I will answer it. I have some doubts in question three. Don't stop at the question too much time, okay? Skip it, go for question four, answer it. Question five, like that's the first round, okay? Until you finish the 100 question. In the second round, go for the questions you skipped. Now try to calm down, think about these questions. Why I'm saying that? Because if you stop in front of the question, you feel that it's difficult or confusing, okay, and you spend too much time, you will feel that your heart rate is starting to get faster, okay, and you are stressed. But once you finish the 100 questions and you feel like Alhamdulillah, I have answered about, or I have like 50 or 60 questions I'm totally sure about. So now I am almost reaching the passing mark. Okay. So you are going to be calm and you are going to think well for the other questions. Okay. The question stem or the question heading is variable. Okay. You can find some scenarios long and you can find some scenarios very short or like just one line. And also, this is a very good question because sometimes you can find a long scenario, but at the end, the question is so direct. For example, you can have a scenario for like a newborn is a newborn baby, and the midwife have seen the baby, and the baby is having ambiguous genitalia, and something like that. And you are going to think that the examiner will ask you about the diagnosis or something, but at the end, he will ask you, for example, what is the origin, or example, what is the embryological origin of the, for example, the clitoris, or what is the embryological origin of the ovary, for example. Very direct question. So the scenario will just a distracting intro, okay? So don't panic when you see a long scenario. Read it carefully, then you can answer your question. How much paper repeat from recalls? That's something variable. We cannot confirm it. Like sometimes 40%, 50%, maybe more. Some candidates say that 80, 70, or 80% is repeated. Okay, it depends. Okay, because you know that's a question bank. The college have a question bank. Sometimes they change. Sometimes they bring same questions. So we cannot guarantee the percentage. But of course, there will be repeated questions. But I don't rely on that, and I don't advise anyone to rely solely on recalls. You have to depend on your concepts. That's why you have to study and answer questions. Reading theory plus answering questions, you will get this is the best combination ever. Don't rely only on questions or don't rely only on theory. Okay, you have to merge the two strategies. So I think these all the questions shared in the chat box. May I ask the backend team to move the slide, the next slide? Yes. So I'm just telling you that we are starting our revision workshop on the 1st of January. It will be 11 days workshop. In each day, we are going to answer 1 year of the recalls. And through the workshop also, we are going to have 4 meetings, 2 meetings with me, inshallah, and another 2 meetings with my dear friend and colleague, Dr. Desiree. She will also guide you. And in these meetings, we answer some confusing questions or making a confirmation of some answers. So this is our next workshop. Next, please. Yes, the revision workshop will be a daily discussion of important previous questions on a group or on a Telegram group. And also, like I told you, there will be live meetings with the mentors so that you can confirm some answers, or we can also talk about the preparation more and how to reassure you before the exam, inshallah. Next. This is our timeline for the next batch. I know some colleagues are already asking for preparing for the next exam. First, I know that you all know that the exam was in July, but next time. Can you turn off your mics, please? Okay. Okay, so next exam is not in July. Next exam will be in the 30th of June, last day of June. Okay, so it's the June exam, not July exam. We are going to start our preparation immediately after the January exam. We are going to start in the 12th of January. Okay, this is called the pre-course activities. And this will last from 12th of January to 27th of the January. What is the pre-course activities? Please, if there's someone is, playing with the tools of the Zoom meeting, stop, please. So it's not me. I'm not doing this. Okay. So the pre-course activities, we are providing you with some recordings. These recordings is a warm-up phase, like some recordings in anatomy, not the entire subject, of course. It's just small topics. It's called the warm-up phase. The importance of this phase is to get you into the mood of studying, plus also making, or sparing time for more topics in the live sessions. So this 2 weeks is just a warm-up phase. But also these topics will be covered again in the main phase of the course. I mean, when, for example, if I provide you with 3 or 4 recordings for anatomy, I will give you more days in the live sessions phase to study these topics again or to access these topics again. So even for the colleagues who join us after the pre-course activities, you will still have the time to go through these topics again, okay? Then we start the live session phase. That's the main course phase in 28th of January, and it will be finished on 7th of May. Here, we give you a live session or 2 live sessions according to the subject. Some subjects are covered in 1 live session or maybe in 2 live sessions. And after that, you will have time to study the subject. And after that, you will get access to an online topic test to evaluate yourself. Of course, each day, whether in the pre-course activities or in the live sessions or in the revision phase, our moderator, Dr. Noura, will be following up with you, sharing questions, replying to your queries, and also me and Dr. Desiree will be there also supporting you and answering your questions. After finishing the live session phase, you will have the statistics workshop for 1 week with Dr. Desiree. After that, we start the revision phase in the last month before the exam. In the revision phase of the regular course or the main course, we answer questions, we answer the recalls also, and give you a schedule to revise the topics every day. We have also the other course, which is the revision course, or what we call the progressive course. We are going to start that at the 14th of April. And this course includes the statistics workshop also, and also it includes the recalls workshop. Next, please. So this is the timeline again, but this is the design of the regular course. We have 4 parts: pre-course, live sessions, statistics workshop, and the revision phase. And we have the progressive course In the progressive course, we give 5 bundles. Each bundle contains 2 or 3 subjects. In the progressive course, we do the reverse strategy. I mean, we give you access to the recordings, we give you access to the materials, you study them, and then we have a revision session, okay, to sum up the important points in these subjects. But also this course includes the statistics workshop, and it includes the recalls revision or the recalls workshop. Next, please. This is the schedule of the pre-course phase or the warm-up phase. Like, can you see each day we give you access to certain recordings. All you have to do is to listen to these recordings. We don't want you to do much effort at that phase. Just listen. Okay, listen and get some information to prepare yourself for these subjects. Next, please. Yes, that's the continuation of the pre-course activity phase. Next. This is the live session phase. As you can see, we are going to start by the 28th of January. We have anatomy subject, and anatomy will be given in 2 live sessions on Wednesday and on Thursday, for example. After that, you will have a study duration. Okay, you will finish the subject, and then you will have an access to a topic test. This is how we are going to study each subject. Then we have access to the next subject and so on until we finish by the 7th of May. After that, you will get the statistics workshop with Dr. Desiree from 8th of May to 14th of May. And after that, we are going to start the revision phase. Next. This is the course, this is the revision course plan. As you can see, we give you study time first. You will get access to the recordings and we will have discussion in the study room. After that, we will have a live session to sum up the important points about each bundle. Then you will have a topic test to evaluate yourself. Okay, so as you can see, we focus too much on preparation by answering questions. Every day we answer questions in the study room, and also you will evaluate yourself by the online topic test, which is exactly like the exam pattern. So you will be feeling that you are answering in the exam. It's a computer-based exam now, so you will have an access to the topic test on your profile on MedExam Expert website, and you will test yourself. You will have a time, you will have a score, and you will have also explanation of each questions. Next. This is the June recall revision. Okay, it will start by the 16th of June and ended by 26th of June, 4 days before the exam. Of course, we should give you like 3 or 4 days, free days for yourself. That's the time you will make your last minute revision, and of course, you will focus on your weak points. But you will get the support and the guidance until you enter the exam hall. So don't worry, we will be giving you all the access to all materials, and we're giving you all the support until you take the exam, inshallah. Next. Yes, of course, our study room is a Telegram group. And of course, we use the Telegram because we can save materials there. And also, if you join late, you can access the old messages, unlike other platforms or social media groups, in which it's difficult to access old messages. So that's why we focus on Telegram. Plus, it's a good application for sharing the questions like in a polls form. That's why we use the Telegram. Next. Of course, as you can see that the main is the live session, and in the live session we will have active participation. By the way, I mean that it's not only theory in the live session. After finishing each topic, we share questions also, and I test your follow-up and understanding. So attending the live session is very important. But if you miss the live session, don't worry, the recording will be available. So if you have any commitments or any duty and you cannot access the live session at time, don't worry, the recording will be available after the live session, and you can access the session whenever you want. Next. course, it's very important to make use of the study time we give for each subject or each bundle. So in this study time, we will give you a study schedule. We are not going also to leave you by yourselves. Okay, I mean that when we finish the live session of anatomy, I will give you a schedule, which topic to cover each day, and according to this schedule, Dr. Noura will share the questions. So we are following up with you. Okay, every day we are making everything okay organized for you. So all you have to do is just to follow the instructions. Okay, next. Like I told you, for each subject, with this will be there will be a recorded session, okay, and you will have access to the sessions whenever you want, okay. Even if we finish one subject like anatomy, and when we are now taking physiology or endocrinology, and you want to listen back to anatomy, you will get the access, or you have the access whenever you want. You get this access. So once a subject is open, it will be available for you until the day of the exam. Next. It's very important to evaluate yourself, okay, to take the topic test in time. And to encourage you also to take the topic test, we share the top scorers, and the top scorers will get some rewards from mid-exam expert by the end of the course, like discount on part 2 or next courses and so on. So makes make sure to study well to get high scores to pick up some rewards from mid-exam by the end of the course, okay? So it adds some fun also, okay, when you are having like some challenge while you take the test. It's add some fun also, so it's a good thing to study well. Next. Statistics workshop, of course, is very important. Dr. Desiree is brilliant in statistics, and I know statistics is making a problem for many colleagues. Okay, so that's why we separated the statistics. Okay, previously it was just like any subject, we give it a live session, but now we give it a separate workshop. Okay, sessions plus time, enough time to study and to evaluate yourself. Okay, because we need you to understand these statistics concept, because it will be very important not only for part 1 but also for part 2. So that's workshop also is attended by part 2 colleagues, okay, because statistics is the same syllabus for part 1 and part 2. So it's something very, very beneficial to attend. Next. Okay, I have some questions to share with you, but before that, let me also look back again to the chat box to check if there are more questions to answer. Okay, for books and information about studying, you can access the free group on Facebook, the MRCOG Part 1 Guide group. Okay, and I will also share, and I think this post is shared also in our free Telegram group. There I mentioned the important books and important topics for each subject. So you can ask the team to guide you for these free groups, and you can look at this post. It will summarize everything for you. If there is a live session on Recall PDF, no, it's not a live session. It's a daily practice in the Telegram group, but we gather the difficult points and we will have a meeting, live meeting, to confirm some answers or clear some queries. For procedure or for classes timing, all the schedule is now with the team. You will have access to all the information. Just contact the team and they will give you the course catalog and everything about the course. I don't like this question. One question, if someone is failed and want to continue mid-exam course, inshallah, no one will fail with mid-exam. But I think the company also provides some extension for the colleagues who want to continue for extra time. Okay, so also this information can be given from the team. Yes, you can skip questions in the exam. I told this before. You can skip the question and go back to this question again after you finish other questions. No negative markings in the exam, guys. Okay, no negative markings. If you don't know the answer, then guess the answer and pick it. Okay, that's a good thing about MRCG Part 1. Your guess might be correct. Okay, no, you don't have to pass both papers separately. The two papers are added together. The two papers are added together. So even if you feel that your performance in paper one is not that good, so don't panic. Okay, regain your strengths and refresh your mind. Then go to paper two with clear mind and make the best performance. Okay, so two papers are added together. The percentage criteria are variable through each exam. It depends according to the difficulty of the exam and the number of the candidates, but it is usually the passing mark is about 67%, 68% in that range. I always say that when you get more than 70%, you will guarantee success, inshallah. Yes, 68% combined for both papers. Yes. The recall workshop, you will get an access to the recalls, okay, on the website, and each day the moderator will share the questions you are going to practice daily, and we will clear the queries and clear the answers for all the questions, inshallah. Okay, let's have some practice, okay? I will now share some questions, and I want you to think about the answers and write your answers in the chat box, okay? Next, this is our first question. A 23-year-old woman, she is 6 weeks by dates, and she is referred now to the early pregnancy unit with vaginal spotting, which is continuous today. Ultrasound shows a fetal pool with a crown rumblance of 4 millimeter. There is no fetal heart action noted. The ovaries and adnexa appear normal. What is the most likely diagnosis? Yes, so the answer of this question is option C, could be a viable pregnancy. Why we say it could be a viable pregnancy? We can see that yes, there is no fetal heart action noted, but the crown rumblance is still 4 millimeter. We know that we should see pulsations, obvious pulsations when the crown rumblance is 7 millimeter or more. So once we have a crown rumblance of 4 millimeter, we are still less than 7 millimeter, we should give a chance or a more chance to another scan after 1 week or 10 days to confirm the diagnosis. So the answer is option C, could be a viable pregnancy. Next. So the answer of this question is option C. Next question. What is the Haldane effect? Yes, the Haldane effect is option D, the increased capacity for deoxygenated blood to carry CO2. So next, please. Can you see this diagram? We can see that. No, please go back to the, yes, I want to discuss something in this telegram, yes. So The Poor effect and the Haldane effect is having the same idea. It's always the fight between O2 and CO2 for the hemoglobin places. Simply, the predominant gas will win the fight. I mean, at the lungs, what is the predominant gas? At the lungs, the predominant gas is oxygen. So oxygen will win the fight, okay, and replace the CO2. CO2 will be released for hemoglobin and be exhaled from the lungs, and oxygen will take the places and transmitted by the hemoglobin from the lung to the tissue. At the tissue are doing metabolism, so they are producing CO2. CO2 is prominent, so CO2 will win the fight, force the oxygen to leave the hemoglobin, and the oxygen will be taken by the tissues, and CO2 will take the places at the hemoglobin to be carried out by the hemoglobin to the lungs again to be exhaled. And this is a continuous process. So oxygen take the places at the lung, carried by the hemoglobin to the tissues, then released to the tissues. Then CO2 will take the places at the tissues, carried by the hemoglobin, then the CO2 will be exhaled by the lung. What's happening at the lung is Haldane effect. And I always say to remember it like Haldane contain the letter L. So Haldane, lung. Okay, lung contain L and Haldane contain L. While Poor effect at the tissues. Next, please. Look at this ABG and interpret it. We have values of O2, CO2, pH, bicarb, and the O2 saturation. So when we look at the pH here, the pH is 7.15. As you can see, it's very low pH. So it's acidosis. The next step is to look at the CO2 and the bicarb level and check which of them is abnormal and matching with this pH. If we look at the CO2 is normal. So the CO2 represents the respiratory system. So there is nothing wrong with the respiratory system. But if you look at the bicarb is very low. That means that there is some affection in the metabolic system. So it's metabolic acidosis. Now look at the O2 saturation or the partial pressure of the O2. We are going to find that they are low. So it's a metabolic acidosis with hypoxemia. That's how you interpret the ABG. And make this your strategy in all the questions. Look at the pH first, determine whether it's acidosis or alkalosis, then look at the CO2 and the bicarb, then determine which system is having the problem, and at the last step, look at the O2 saturation to check if there is hypoxia or not. Next question. What is the correct interpretation of this urogram? When we interpret a urodynamic chart or a urogram, we have a key point to check, the detrusor muscle activity. We can see that we have 4 traces. One trace represents the intravesical pressure, one trace represent the intra-abdominal pressure, one trace represent the detrusor muscle activity, and one trace represent the flow rate of the urine. Okay? And we have two phases of the urogram. We have the filling phase when we fill the bladder with fluid, and then the voiding phase when we ask the patient to micturate or to void the urine. The key point or the key information we should always keep in our mind that the detrusor muscle do activity only in a normal individual, only in the voiding phase. So if you see a detrusor muscle activity, like you see in the third trace, okay, that there is a detrusor muscle activity in the filling phase, this means that there is detrusor muscle overactivity. That's the first point, okay? But wait, don't rush in picking up the answer. We have to look for other points. It's not only about the detrusor muscle overactivity. We have to see if this detrusor muscle overactivity is accompanied by leakage of urine or not. So as you can see in that trace, the last one, okay, from below, in the flow rate below the detrusor muscle activity, the examiner is writing there is leak visualized. This means that when the muscle has some activity during the voiding phase, there was a leakage of some urine. We call this urge incontinence. Urge incontinence. But also, this is not the last answer. There is another thing we have to look at, which is the integrity of the sphincter. We ask the patient to cough, okay, or to do Valsalva maneuver, and look if there is escape of urine. As you can see, when the patient is asked to cough at the end of the voiding phase, there was also a leak visualized. Means that this patient also has stress incontinence. So the patient here has two problems, urge incontinence and stress incontinence. So the final answer will be mixed incontinence. Mixed incontinence. Next question. Which of the following options best describes insulin resistance and lipolysis in pregnancy? This question means on which energy store does the pregnant woman mainly relies on? We know in pregnancy there is insulin resistance. Okay, that's a clear point. But does this insulin resistance is accompanied by hyperglycemia or hypoglycemia? That's the trick here. And here I'm not talking about a diabetic patient. This is a normal pregnant woman. Okay. So in pregnancy, because the baby takes the glucose from the mother, because it's a rapid source of energy, the mother is usually having relative hypoglycemia. Okay. So the mother needs energy, so she will depend on her fat store. So the insulin resistance and the relative hypoglycemia will lead to increased lipolysis. So the mother depends on the fat store. So the net result is increased lipolysis. So the right answer is option D. Next. From which of the following structures are the superior parathyroid glands derived? This is one of the important points, by the way, in embryology, to study by heart the derivatives of the pharyngeal arches, pouches, and clefts. This is very important. So here is the pouch of the fourth pharyngeal arch, the pouch of the fourth pharyngeal arch. Show the answer, please. Yes, this diagram shows you to the derivatives of the pouches and clefts. And also there are derivatives of the arches. This part of embryology, like it's about 20 to 30% of the questions of embryology. One of the very high yield topics that you need to cover before the exam. Next question. This is the DEXA scan. One woman had her DEXA scan, and the T-score is minus 1.4. What is the classification according to the WHO criteria? So according to this T-scoring system, minus 1.4 means that the patient is having osteopenia. Please show the answer. Yes, so as you can see, the WHO classification is or depends on what we call the T-score, which gives the bone mass density like a value related to the standard of the normal individual. So if the T-score is from one standard deviation below the adult mean or above, this is normal. If it's from minus 1 to minus 2.5, this is called osteopenia. Below minus 2.5, this is osteoporosis. And if the patient is having the T-score less than minus 2.5 plus a history of fracture, this is called severe or established osteoporosis. Next, please. In primary hyperparathyroidism, what will be the correct value? Yes, in the net result of the parathormone hormone is increase in the calcium, decrease in the phosphate. Please show the answer. Yes. As you can see, the action of parathormone hormone is increasing bone resorption and increase kidney excretion of the phosphate and increase vitamin D activation and decrease calcium excretion. These are the physiological actions of the parathormone hormone. So the net result of these actions will be increase in the serum calcium and decrease in the serum phosphate. So if the patient is having primary hyperparathyroidism, which is increasing the level of parathormone hormone, the net result will be increase in the serum calcium and decrease in the serum phosphate. Next. As you can see, this is one of the things I have mentioned in the beginning of the webinar, that you can see a very long scenario, but by the end, the question is so direct. Like this is a newborn baby having ambiguous genitalia. The midwife was worried and she called the doctor. So of the following associations, regarding embryological development, which one is applicable? Yes, this is very clear. It's simply the genital, tubercle, and the clitoris. Okay, the genital, tubercle, and clitoris, because germ cells and the extraembryonic mesenchyme, no, it's the germ cells come from the endoderm of the yolk sac. Mesonephros and kidney, no, it's the metanephros. The Mullerian duct and Gartner cyst, no, of course, it's the Gartner cyst comes from the Wolffian duct. And the Wolffian duct and the fallopian tube, no, of course, it's the Mullerian duct and the fallopian tube. So also the embryological origins of the genital or the genitourinary system, and their homologous also in male. You have to know this structure. For example, in the male, like the penis is equivalent to the clitoris, the scrotum is equivalent to the labia majora, and so on. So this is very important part in embryology. Next question. This is a woman complaining of menorrhagia. She is diagnosed to have endometrial hyperplasia without a tibia. The risk of her disease progressing to endometrial cancer is it? This is one of the very important percentages you have to know that when a woman is having endometrial hyperplasia without a tibia, the risk is less than 5% over 20 years. Less than 5% over 20 years. Next, please. Rheumatoid arthritis falls into what type of hypersensitivity reaction? This is also one of the important parts in immunology to know the different types of hypersensitivity and the examples. Yes, of course, it's type 3 hypersensitivity. Next. This is a woman who attend for an ultrasound scan for checking the baby and the placenta, and an MRI was organized because there was abnormal placentation, and the MRI report shows the placenta is lower anterior, which invades through the myometrium down to the uterine serosa. What is the most likely diagnosis? Please show the answer. No, the answer is not per Creta. I can see that many people saying per Creta. It's in Creta. And according to the guidelines, this is a screenshot from the guideline. To be answering the question as per Creta, the examiner should tell you that the placenta is invading through the serosa to a surrounding organ, like the bladder, for example. But as you can see, in Creta, where the villi penetrates deeply into the uterine myometrium down to the serosa. If he's not mentioning that the percreta or the placenta is invading other organ, it's just down the myometrium or down to the serosa, it's just in creta. Okay, so the abnormal placentation, accreta itself, where the placenta is superficially adherent to the myometrium, okay, without intervening decidua. In creta, villi penetrate deeply into the uterine myometrium down to the serosa, while per creta, the villus tissue perforate through the entire uterine wall and may invade the surrounding pelvic organ, such as the bladder. So these are the clear definitions from the latest guidelines of the placenta accreta spectrum. Next. Capturing, processing, and presenting the antigen to T cells are the only function of which type of cells? Of course, the answer of this question is dendritic cells. We have three types of professional antigen presenting cells. They are the macrophages, the P lymphocytes, and dendritic cells. But macrophages and P lymphocytes have other functions, like macrophages have a phagocytic function, P lymphocytes create antibodies, while dendritic cells only present the antigens to T cells. So it has only one function in our body is presenting the antigen to the T lymphocytes. Next question. When a woman is severely allergic to penicillin, which drug is advised in labor as GBS prophylaxis? Yes, if a woman, of course, we know that the intrapartum antibiotic prophylaxis for group beta streptococci is benzyl penicillin. If a woman is having some allergy to penicillin, it's not severe, we can give a cephalosporin instead, like ceftriaxone. But here, the examiner said that she is severely allergic to penicillin. In such case, we have to avoid all the beta-lactam family and pick up vancomycin. And never to pick up clindamycin because clindamycin has a resistance rate now, so we don't give clindamycin at all. So the answer is option D, vancomycin. Next question. When should be the last therapeutic dose of low molecular weight heparin stopped before regional anesthesia? Yes, we have two questions related to this part, therapeutic and prophylactic. If we are having prophylactic dose, we should stop at 12 hours. But here the examiner say therapeutic, so therapeutic should be stopped 24 hours before regional anesthesia. Next. This is a primary gravida, 22 weeks, and upon examination, she had absent clitoris and normal epimenorrhea, and she's scared to have vaginal delivery. Of course, this is kind of genital mutilation, and genital mutilation types is very important. Of course, the genital mutilation guideline is a very important guideline for part two exam. Okay, because we have some recommendations and laws and something like that related to the practice. But for part one, all you need to know is the types. And of course, this is type one. Next. Of course, this table is from the guideline and show the types of genital mutilation. Next. This is a newborn baby, undergoes assessment. The body is pink with blue extremities, has a heart rate of 150 beats per minute. He demonstrates gasping, feeble cry, little flexion, arm stimulation. What is the most likely Apgar score? Apgar score, by the way, is also very important. And here, yes, the Apgar scoring is 6. Okay, why? Because when the body is pink with blue extremities, this takes a score of 1. Heart rate of 150 beats is normal, 2. So 1 plus 2 is 3. Then gasping 1, feeble cry 1, little flexion on stimulation 1. So the total is 6. Next, show the answer, please. So this is the Apgar score. So blue or pale, 0. Blue extremities, body pink, which is called acrocyanosis 1. No cyanosis, and all the body is pink, score of 2. Heart rate absent, 0. Less than 101, more than 102. No response to stimulation, 0. Grimace or feeble cry, 1. Cry or pull away when stimulated, this is 2. None activity, 0. Some flexion, 1. Flex arm and legs that resist extension, 2. Absent respiration, 0. Weak or regular gasping, 1. Strong lusty cry, this is 2. Next. Which of the following structure that leaves the pelvis through the lesser sciatic foramen? Also from the important part in the pelvis like studying the anatomy of the greater and lesser sciatic foramen structures passing through them. Okay, and of course, the only structure that leaves the pelvis from the lesser sciatic foramen to be inserted into the greater trochanter of the femur is the tendon of obturator internus muscle. The tendon of obturator internus muscle. Next, what is the angle of the vagina with the horizontal plane when standing? Actually, the angle of the vagina with the horizontal plane is 45. 45, not 60. 60 is the angle of the pelvic inlet. That's a part of confusion, by the way. Next, show the answer, I mean. So the angle of the vagina is 40 degrees in related to the horizontal plane. If we are asked what is the angle between the pelvic inlet or the plane of the pelvic inlet and the horizontal plane, it is 55 degrees or 60 degrees. Okay? It's a range, of course, from 50 to 60, average 55, but you can pick up 60 if 50 is not, or if 55 is not mentioned in the option. So here it's a part of or a matter of confusion here. So don't be confused, please. When he talks about the vagina, it's 45 degrees. When he talks about the pelvic inlet, it's 55 or 60 degrees. Next. Which of the following is a non-essential amino acid? This is also one of the important points related to biochemistry to study the essential and non-essential amino acids. Of course, it's tyrosine. It's tyrosine. Yes, tyrosine is a non-essential amino acid. Others are essential amino acids. Next and last question. In which part of the cell does glycolysis take place? This is also one of the parts of biochemistry that's very important to study the metabolism of glucose, the glycolysis, what's meant by the oxidative phosphorylation, the Krebs cycle, how many ATPs are formed. Yes. So, of course, glycolysis takes place in the cytosol, yes, in the cytoplasm or in the cytosol. Next, by this we yes, this is how glycolysis takes place. In the cytoplasm, glycolysis takes place, and then after that, in the mitochondria, Krebs cycle and oxidative phosphorylation. Through the aerobic metabolism, of course, we will have about 36 to 38 ATPs formed. So by this, we come to the end of this free webinar. I hope you find it beneficial, the advices and the information from or about the courses. If you want to join us, in the end of anaerobic glycolysis, it's just 2 ATP. Yes, 2 ATP from the anaerobic. Thank you so much, everyone, for joining me in this webinar. And of course, again, I would like to apologize for some delay of the technical problems. If you need any help from the team about the contents or the materials, send them a message. I think they sent you the links how to contact them. The end product of anaerobic, yes, anaerobic, the end product is lactate or lactic acid and 2 ATP only. Okay, this is the anaerobic. For the aerobic, glycolysis is pyruvate, and then pyruvate will enter the Krebs cycle to make some intermediates, and these intermediates would be used by the oxidative phosphorylation to produce 36 to 38 ATPs at the end. Again, as for the books, I told you that the team will guide you for the free group on Facebook, and there you will have a post, long post talking about the books and all the topics you need to study. But if you are joining the course, you don't need to open any book, okay? Because we provide you with the PDF which is needed for studying, because we summarized all the books and look at them at and put it on one PDF to make it easier for you. Difference between them is about 32 to 34 ATP. Yes, aerobic will give us pyruvate. Okay, pyruvate after glycolysis become converted into acetyl-CoA, and acetyl-CoA will give more ATP by the Krebs cycle and oxidative phosphorylation. But pyruvate after glycolysis, okay, if the metabolism is anaerobic, it will enter another cycle called Curie cycle, okay, and lactic acid will be formed, and then pyruvate, I mean, it will be converted into lactic acid, and lactic acid will be entering another cycle called Curie cycle to produce glucose again, okay. So this is the difference between the aerobic and anaerobic metabolism. Thank you so much, everyone, for joining me this webinar, and I wish you all the best in the part one exam. Please calm down, focus very well in these days. This is the best timing, this is a critical time before the exam. You have to sum up what you have studied, you have to practice more and more, okay? And don't panic, the exam, inshallah, is easy, and you will pass the exam. So again, I wish you all the best of luck. At least make 3 to 4 days for answering questions, 3 to 4 hours, I mean, per day for answering questions, and just 1 or 2 hours to read quickly if you have the time to read again, or at least listen. If you have access to the recordings, if you are one of our candidates already, then if you don't have the time to read, you can also listen while you are at the work or doing something. You can listen to the recording and then practice questions. But at least not less than 5 hours per day studying, okay? And this is very important. Wish you the best of luck, and stay tuned for more webinars, and inshallah for the June batch we are going to start in January, so we are looking forward to see you in class. Thank you, see you, bye bye.